My name is Mahesh Ramchandani. I'm the Chief of the Division of Cardiac Surgery at the DeBakey Heart and Vascular Center at Houston Methodist Hospital in Texas. So, aortic valve replacement is usually done through a sternotomy, where the sternum is split open. There are more and more minimally invasive approaches that are being used now, and this is important for our patients because they recover faster, they get back to work faster, and not only that, it's much kinder on patients who are elderly and frail and who will not tolerate having their sternum split open. The approach that I use is a right anterior thoracotomy approach, which is a small incision that's made in the chest, on the front of the chest on the right side, without touching the sternum. It's a technique which allows you to do the operation safely, quickly, and gives the patient a chance for a faster recovery. This is something that I believe in greatly, and I'm glad to have the opportunity to share that expertise with you here at this meeting. Multi-vessel, minimally invasive coronary bypass surgery is a technique that I have performed now for some years. This is a technique that allows you to perform more than one bypass on patients who have severe coronary disease that is not amenable to stenting. The technique involves making an incision on the left side of the chest, avoiding the sternum, leaving the breastbone intact, and being able to perform more than one bypass on patients who need it. This is the kind of surgery that allows people to get back to work sooner, and the patients that typically benefit from it are those who are breadwinners who need to get back to work sooner, people that may own their own business, for example. The other group of patients are people who are elderly, debilitated, frail, who simply would not tolerate having their sternum split open. It's a pleasure to be able to have the opportunity to share my experience and expertise in this area with my colleagues here at Apollo Hospital. Conventional techniques of performing bypass surgery involve hand suturing. And this is a very efficient and good way of doing it, and certainly something that is still the most widely done. However, there are devices that are available, anastomotic devices. These are devices that allow you to join a vein to the aorta or a vein or artery to a coronary artery using an automated stapling device or fastening device. This greatly speeds up the operation and actually facilitates the ease with which you can do these procedures with a minimally invasive technique. This is something that I have some expertise in, and I shall be sharing that here at this meeting. Traditional approaches to cardiac surgery are very good. We've gotten much better over the years, and certainly they still remain the most important way of being able to treat and cure our patients who present to us with life-threatening conditions, cardiac conditions. But it is possible to do many of these operations now using minimally invasive techniques. And where one is able to do it safely, these patients recover faster, have less need for blood transfusion, can get back to work sooner. And in the case of the elderly and disabled people, they are able to tolerate these operations better because they don't tolerate having their chest split open as well as a younger person might. So minimally invasive surgery offers these advantages, but it should not be performed unless the person doing it knows how to do it safely, because patient safety should never be compromised.